We should do so.
Just kind of get us loosened up.
I think we should.
Be on a Friday afternoon when we're not busy.
Yeah. Can't imagine it would be that hard.
Just gotta make sure it's worth the time, especially with
We don't
commuting
have
there,
minimum
wherever it
materials so
is,
far.
commuting home. You know, hopefully she would count that time. Because for a time,
The time driving?
yeah, for real.
I don't know. The thing about it is that she would have to give us the same amount of time, or the same amount of hours, which is another layer on top of whoever has to make the PowerPoint. It's Miss Rose.
Although I do love Coke Zero, and Miss Warren does too. Miss Rose keeps them in the refrigerator in her office. She loves Coke Zero.
To decorate, that's Miss Warren.
Think about it and get it.
I think it's Miss Warren.
She's always decorating her yard, you know, her house.
See her decorate the house for Halloween.
Oh, wait.
She has a lot of publications. Now, Miss Mitchie has a publication from her master's. And I have a publication from my master's, but Miss Warren got us from. You know, Miss Warren used to be in research.
Eight fish? That must be Miss Atkinson's own.
I don't know.
That must be Miss Atkinson.
She would be the cover set.
I don't see Miss Rose having 8 fish. Miss Atkinson, yes. I can see that. What? She has 8 fish? She never talked about her.
8 fish.
We were too busy on the whatever it was, that worksheet she gave us. It's the plant lady? Oh my god.
She lives here. Maybe it's Dr. Tucker.
Yeah, I'm gonna say.
I don't know.
No, I want to say Miss Warren again for some reason. I was Miss Fairbanks.
Oh, yeah. Miss Nan, anytime she comes and checks on my plants in my office weekly. Also, Miss Nan. I propagated some more plants for you. She's brilliant with plants, Miss Nan.
Oh my god, I can't remember.
By the way, all of them know I've put this on there, so they're comfortable with things I'm saying.
I don't know.
Me and Miss Mitchie were former dental assistants.
Why is this so hard?
I don't know, because we don't know any of this stuff. We're guessing on vibes alone.
I said Rose too, just because her name.
So much sense. Oh gosh.
You say Warren. Yeah, I can see that.
She never gave us chocolate though.
No, she's more Smarties.
That's not chocolate, guys. It's Smarties.
That's what I'm saying.
I guess you're right. We ever need a gift for Dr. Tucker? Chocolate. No flowers. Yeah, no flowers.
Oh, hey, look.
But who drinks coffee?
Do you know?
I'm pretty confident about this one. She got the coffee bar started. Was it?
Miss Rose?
That's what I'm thinking. I mean, I remember her saying that.
But I've never seen her drinking it though.
Oh, I scared you.
She getting started about her coffee. She was praying by the coffee machine this morning.
I swear Miss Rose said she got that
No, this
coffee.
caffeine giving.
She
You
probably
ever
did.
you ever see her drink coffee though?
That's the Coke, though.
Oh, we know that one. I know that one.
I don't.
That's a story. 'Cause she always smells like syrup or pumpkin.
Ooh.
Yeah. She said it's her favorite year long. She doesn't care what season.
That's fair.
She loves pumpkin.
That's why I always smell the way I do, because I wear fall lotion year round. I'm trying to make it cool.
Oh my gosh.
That's where I
Yep. Oh, it's gonna be both though. It's gonna be both.
Oh, I didn't see what you
Miss Atkinson. Miss She needs to notify. Update my quiz. Alright, let's see who won.
We get the treasure box.
You get bragging rights today.
Give us Leah. Just still first.
Whoever, Macy, woo! Alright, I thought that'd be fun, kind of listen to that. Okay, so I realized that on Monday I got to talking and I forgot to do something, which happens often, and I apologize. Remember when I said I wasn't perfect in the beginning? A lot of you have asked me about the lab portfolio. So if you go into community and hit assignments, it's at the very bottom. Okay, there's a rubric. There's an example of a student who did a really good job. That way you have a template to go by. And then there's also a submission link. Please note, please refer to pages 5 through 13. Okay? So this is an assignment that you're going to turn in for the community service associated with this semester. And the next semester, you're just going to build onto it. Okay? So I've got it pulled up at page 5. I don't care if you copy and paste this table and then insert your stuff in it. That's what I would do if I was you. Make it a lot easier on yourself, right? So my suggestion to you would be, as you're completing your community service, you start doing this. Why? It's very simple. It doesn't take that much time. However, if you wait until November to do a bunch of simple things, become a big ordeal and takes hours to do. So my suggestion would be, as you're completing your community service, put it in the graph, and then write a little little short paragraph about your experience, okay? This helps me see what you've learned, what went well, what didn't, so I can think about this for future cohorts, okay? Oh, everybody loved this, we need to do more of this. You see what I'm saying? That's all it is, but you can see how this would add up. If you've got 20 hours of community service and you haven't done any of this, a simple activity that would take 10, 15 minutes to achieve, now it's become a multi-hour activity. So that would be my suggestion to you. So that's all the lab portfolio is. It's essentially, hey, this was my community service, and this was my experience with my community service. Okay? It's very simple.
It's dental and non-dental, right? Like all of your.
Yeah, okay, all your community service. I'm pretty sure one of hers, yeah.
Yeah.
So they volunteered with the Ronald McDonald House, and they had, a marathon event. It was called the Shamrock Shuffle 5K. She basically told about her role for the day, what she enjoyed about it, what, she would have enjoyed if she didn't enjoy something, right? Okay, any more questions about the lab portfolio? I also want to bring your attention to the announcement simply because if you come across an issue with logistics, right here is the information. So just to kind of further explain, I am the liaison for interprofessional education for our program. I don't have access to change anything on logistics, unfortunately. I can't log into logistics and make something work for you guys. That is gonna be put into the court of the students that are over 12th Street. That's part of the responsibility in that role, and that changes each year. So as you can imagine, when we take on a new role, sometimes we're not perfect at it, we make some mistakes. And inevitably that happens every year. That's why I'm not surprised that there's issues, okay? So that, to prevent myself from getting 50 emails a week about it, if you ever come across a problem, this is the directions on how to deal with it, okay? So if you're experiencing an issue, this is the student that's over the 12th Street location this semester. I'm not sure if she's over it into the spring, but I'll find out. They'll let me know. You also need to CC Dr. Halverson. Why? Because she's the director of 12th Street, and if something's CC'd to her, it's gonna get taken care of. It's not gonna fall through the cracks. If you wanna let me know in the meantime, that's fine, but just don't have the expectation that I'm gonna be able to make the changes. I would if I could, but I don't have that access to logistics in that way, okay? So again, if you're experiencing an issue, let's try to deal with it in a timely manner. So if you notice a couple weeks out that you try to sign up for it, it's not working, go ahead and reach out to the student. Be mindful, they're a student just like you, they have a schedule that they have to adhere to just like you. You may not receive an email back within 20 minutes. It may be a couple days. But I guarantee you, if you CC Dr. Halverson, it'll be addressed sooner than later, for sure. In the meantime, please show up for your commitments, right? And, all I ask is that you try to deal with these in a timely manner. I will help on my end as much as I can, but there's only so much that I can do with logistics. So again, I put that on your reminders in community, that way you have access to that information whenever you need it and you come across a problem. Okay. Let's jump into community. Get my water here. Okay, so our objective, we're gonna talk about public health. That's really what the community's dealing with. And our profession is in the heart of public health. That's how it was developed, really. We're gonna talk about the evolution of public health, dental health public practice, and factors affecting dental public health. So just in your own words, what would you think public health deals with? What do you think it is? We're educating the public. We're serving the public. We're treating the public, right? In any way, shape, or form, We're dealing with epidemiology, we're dealing with disease, the prevalence, the incidence of disease, that kind of thing. So again, it's concerned with the healthcare of all people. Of course, you care about the individual patients, but this approach is more on a community level, okay? So we're looking at a population versus just one individual sitting in front of us for 45 minutes at a time. It's a lot more strategic approach. So the goal is to protect and promote the health of the public across 3 essential domains. Very important for you to know these 3 domains. This is a foundation for the remainder of the course. Domain 1, health protection. Domain 2, disease prevention. Domain 3, health promotion. So public health is such an essential component of our society. It's just like, a lot of times we get hurt in our daily lives and we don't really think about it on a daily basis, right? We probably take for granted clean water in the United States. Not every country has that. Even some rural areas in the United States don't have clean water. Public health deals with that issue, right? Because that ultimately impacts everybody in our society. We have to have water to survive. Pandemics, epidemics, that's gonna deal with public health, right? And that's really close to all of us because we just dealt with COVID, right? We're still dealing with the aftermath of COVID. It's probably gonna end up being how we look at the flu every year, right? Food deals with public health. Anytime someone has a severe allergy or food poisoning. Has anybody had food poisoning? That's the sickest I've ever been in my life. It was awful. And again, it's also going to deal with safety. Public health also deals with the safety of people within our society. And again, most people don't really give much thought to it on a day in and day out basis. And that's just the YouTube videos that Happy's on live. Until we're faced with a crisis. Has anybody ever felt like that? I feel like that pretty frequently when I pull my hair out. But the point is we get so caught up in our daily life, we don't think about the impacts on society. We just, not meaning to be selfish, we think about our life, right? So the evolution of public health. Initially, public health was involved caring for a population with disease. It was, hey, let's wait until we have a problem and we'll figure it out, right? Now that focus has shifted for controlling and preventing disease, so we're not in that situation. So prevention enhances quality of life. It helps deter illness or outbreaks, hence why we have vaccinations, right? And it's more cost effective on our society. If we don't have a lot of disease that people have to buy prescriptions for. My father-in-law is a diabetic, he has to be on insulin. And his insulin, with insurance, mind you, is $1,000 a month. Imagine how many people have diabetes and are insulin dependent. Think of how much that costs people within our community on a daily basis. Can you imagine paying $1,000 a month for something you had to have to live? These are things when we're thinking about public health we have to consider. So of course we've had some challenges in the past that we've learned from. Devastating plagues. Well, we don't think about the word plague, right? Because we think about prevention. That's the goal of our society now. And that's where we kind of come up with immunizations. We don't really think about polluted public water unless they'll be like, hey, there's a boil concern. Boil water, it's all over the news, it's on the radio, right? And then of course, they didn't really think about educating the public in a way that we do now. Think about when COVID-19 happened. It was all over the news what you're supposed to be doing. Healthcare professionals were already aware of these things, but the general population wasn't. So the first thing they did, we gotta educate everybody. We gotta get on THV, We gotta get on the internet, we gotta get on Instagram, Facebook, whatever it takes to educate the public. Crisis control, essentially. So this kind of goes back to dental materials. In regard to public health, you can think of the same thing. So the first significant recording of a public health measure was in the United States in South Carolina in 1671, I would highlight. And so essentially this public health measure was a water protection measure. Again, why? Because we all need water to survive. And we don't need to be drinking polluted water, it makes me really sick. So it was enacted to prevent disease caused by polluted water. Just to kind of build on that, in 1798, the United States passed another act, and this act provided relief for sick and disabled seamen. And it established a federal network of hospitals for seamen, and that's how the VA was established. And it led to the creation of the U.S. Public Health Service in 1902. The first one-room laboratory for public health was opened in 1887 on Staten Island, New York, and it was the forerunner for the National Institutes for Health. And this just kind of gives you highlights, if you're somebody that you like to see it in this way. So in 1965, that's when they created Medicare and Medicaid, which are two of the largest federally funded programs. 1970, that's where you see the National Health Service Corps. You can, as a hygienist, get a job with them and actually have really good benefits. 1993, that's when we started a vaccine program for children. 1996, that's when HIPAA was actually established. What's HIPAA? What does it mean?
Your privacy.
Deals with privacy and confidentiality. Good job, okay. And then in 1997, I don't know if anybody's ever heard of the S-CHIP program. We will go into it in further detail. It was created in 1997. Blank slide. Okay, so these public health achievements have happened over time to increase the average lifespan. You know, we hear about it all the time. Back in my grandparents' day and age, it was really common for you to eventually have dentures. But that's not the goal these days. Research has shown that you live longer with your natural teeth. So a lot of you see elderly people all the time who have a mouthful of teeth, right? And because of research, that has helped increase average lifespan. That's helped make that possible for educating the public. Other things that have increased the average lifespan is vaccination programs, actually controlling infectious disease, policies that deal with occupational safety. Now you can think about people that are in construction. If they didn't have guidelines and regulations, they're dealing with heavy machinery. Even with us in the dental materials lab, anybody who's ever trimmed a stone before, you can lose a finger if you don't know what you're doing. It's very serious machinery. So there's policies in place so it can be safe, right? We can do our job and be in a safe environment. Improved family planning. There was no such thing as birth control, but my grandmother was 15, right? Anti-smoking measures. You know, back in the day, I can remember when I was a little girl, you could smoke in restaurants. They say, you want smoking or non-smoking? Well, the whole place is pretty much smoking at that point, right? We know that now. They didn't really know that then. So these are just things that they've come up with over time that we've learned. Okay, well, now we need to have no smoking in the restaurant because guess what? Diffusion, smoke's gonna go all over the place. And again, there's programs designed to decrease public disease. These are public health achievements of the 20th century. Vaccination, motor vehicle safety. Everybody's got to go a certain mile per hour on the interstate, right? This is an Autobahn. Workplace safety, control of infectious disease, safe and healthy foods, family planning, community water fluoridation, and again, recognizing hazards such as tobacco use. Just out of curiosity, I'm curious, what public health achievements do you think are gonna occur in your lifetime?
Well, I hope they did that, Alzheimer's study. People that are organized.
Yeah, I did some research on my thesis project for my master's degree, and I've come across a lot of research where people with Alzheimer's had bacteria that's only known to be in the mouth in their brain. And they're wondering if that's a contributing factor of Alzheimer's, which isn't far-fetched, because we know most of the population has chronic disease. That's interesting. That's a good one. Alzheimer's, yeah, that's scary. What else? Maddie?
Hopefully, a better cure for cancer, or like more.
I could not agree more with that. I'll tell you guys something personal. My mother passed away from cancer in 2020. She had stage 4 lung cancer. And we used to FaceTime all the time because she lived in another state. She lived in Texas. And on FaceTime, I noticed a lump on her throat. And she thought it was her lymph node. I said, Mom, it's too low to be your lymph node. And it's unilateral, not bilateral. And then we have to go into what all that is. And I was just adamant about her going to the doctor. She went to the doctor. Sure enough, they thought she had throat cancer. But when she was there, she got really upset by a seizure. So they took her to the hospital, which ended up being a blessing. Because that's when we found out she actually had lung cancer. And they told me that 96% of the time, people who have lung cancer, you don't know about it. Because the symptoms are kind of like flu-like symptoms. And by the time you find out about it, it spreads all over your body, which is what happened to her. It spread to her brain. And they did all kinds of radiation. And if it wasn't for the oncologist at MD Anderson, I would have had 3 more years with my mother. So I'll always be grateful to them for that. But just to share a personal story, I could not agree with you more because there's all this research, but sometimes genetics can play a role in how do we get past that, right? What else? I didn't mean to make the tone sad. But I just think, again, if we're gonna be on a team, we have to know one another, right? And if I'm asking things from you guys, then it's only natural for me to tell you a little bit more about my experience, right?
I think they should, I think people agree with me. I'm trying to make sure I ask this question in accordance to this. But I think they'll figure out more about, neurology, because I feel like they don't know enough about seizures and stuff like that. I don't know. From what I've been hearing, they don't know the cause of a lot of,
That's a really good point. Stroke's the same way. So many things can cause a seizure or stroke.
right, yeah. What is caused?
I'm thinking maybe something with diabetes, because it's so prevalent. You know, what could they do to, on a cellular level, to do something that doesn't require someone to be on insulin or something expensive like that?
I would hope that the US would ban more ingredients and chemicals. that-
Yes.
Because in France, they have like 2,000 things banned.
That's
And
so
here-
right.
And in here, we have like maybe 100. And she's like, well, that's why we're always sick. We have the most, we're
We're
probably,
obese.
yeah, we're probably the wealthiest in healthcare, but because we're all sick, because of the food we eat, the chemicals we breathe.
Those are really good point. Really good point. So just trying to get you thinking that. I always think about that. I think in our lifetime, I've told you guys this before, that lasers will be a big part of our job. Because it's not invasive, and the healing with the laser with tissue is a lot better. So I think that's gonna be a movement for dental hygiene in my lifetime.
I actually had a girl ask me at the clinic open house if we got to do the laser training. And I said, well, aren't y'all doing it, or didn't y'all?
We're in the middle of doing it because we have to be credentialed in it to teach you guys. So that's something that we've all wanted to do. The laws associated with that within our state are a little tricky, but I think eventually it'll change. But just to kind of open discussion, get us talking. So these disease prevention levels are very important for you to know for my exam. There's primary, secondary, and tertiary. So when we're thinking about primary prevention, I want you to think of it on a hierarchy level, okay? Primary, we're trying to prevent disease. That is all part of our job, right? Prophylaxis would be an example of prevention. A sealant, we're trying to prevent a cavity, right? We're trying to prevent a crisis. We can think of it outside the lines of dentistry, right? Flu vaccination, we're trying to prevent the flu, right? Now, secondary, we're actually employing a method to terminate disease and restore tissues back to the way they were as much as we possibly could, okay? So an example of that, it's gonna be more mid-level. That's gonna be more like a filling in our line of work. So that could be a restoration. A root canal even. We're trying to restore the tooth still, right? Now tertiary is going to be, we're actually employing a strategy to replace. Let's go back. Secondary, restore, okay? Tertiary, replace. Don't let those two words mix you up on the exam, okay? Tertiary, we're replacing lost tissues. So at this point, we're gonna have some kind of surgery, right? We may be replacing in our line of work a tooth with an implant. There's always fine print in life, right? So this is something I found out is on the board exam, and we're gonna talk about it. So let's play a little game again. And I'm gonna pull this up this way. Let's try it this way. I was messing with it. Go ahead, you can take a picture. You'll know how to do these.
Oh, I could do it like that.
And this is to help you realize that when you're approaching the board exam, you
It
gotta really pay
depends.
attention to how they're asking.
And I think there's multiple answers
Right?
that
This
would apply.
isn't to make anybody feel bad or anything like that. Okay, so we're at 93.7. The answer
Mine to
is,
come up. It's both.
oh, no.
Because I answered that in this little booklet thing.
It can be multiple.
Mm-hmm.
Now, I wanna make sure everybody understands me. The primary, most common level of prevention for fluoride is primary. Can we all agree on that?
Mm-hmm.
If you see a question on your board exam that says, when it's used on incipient lesions, they are considering that as secondary prevention. Okay? I want you guys to remember this, highlight this, not so much for me, but for board exam, okay? So again, we're all on the same page. You don't go into the clinic and people think I'm teaching you something way off. 99.9% of the time, it's primary. We're preventing caries, right? But if we're talking about putting it on an incipient lesion for board exam purposes, you need to be thinking about secondary, okay? So just general goals of public health. Of course, we want to reduce human suffering, help children thrive, improve the quality of somebody's life, and again, save money. Core functions of public health. In future chapters, we're really going to dive in to each of these. Because again, when we are dealing with a community of people, a population versus an individual, we have to consider the needs of the population, and that becomes more tricky. So it's more strategic. That's where you see these strategic plans that deal with assessment, policy development, and then implementing those within the public. And that takes time. So if we're assessing, we're identifying a health problem. What's going on, what's the problem? What's causing the issue, okay? Policy development is that's where we're creating goals to address the problem with the population. Assurance essentially is gonna deal with equality. So regardless whoever is in the population, we're treating everybody the same. And we're trying to make sure that it's cost effective for everybody. The rich, the medium, and the poor, right? Serving all functions is going to deal with research. So public health services essentially are interventions. And they're interventions that help attain those public health goals that we've created for whichever population that we're dealing with. And also aids in educating the public. Essentially, in every way, shape, or form, we're looking to decrease the prevalence of disease. So examples of these public health measures could be monitoring a health status. Could be anything, say blood pressure. You can go online and you can get data and statistics from this year regarding public health statistics in the state of Arkansas. You can even get it by county. We could be talking about health hazards, diagnosing and investigating any kind of health hazards. Most of you probably know that mold in the house is not good. Back in the day, they didn't really know anything about that, so that could be a public health measure, right? A lot of times you'll see partnerships being made, because a lot of this, when we're dealing with a population, costs a lot of money. And so a lot of times you'll see a lot of organizations come together. Hence, think about our community service events in the clinic. A lot of times those goodie bags were provided by a nonprofit organization. You know, if it was up to UAMS to have to fund every single little thing that we get involved with, that adds up pretty quickly. Developing policies and plans that support health efforts, that takes time. And that leads to enforcing laws and regulations that ultimately help prevent disease and ensure safety. Epidemiology, I would highlight this. You guys know what this is, you probably dealt with it undergrad. But just to refresh, essentially what epidemiology is a study of disease in a population, and it's gonna deal with the amount, the distribution, what's causing it, or the determinant, and the control of disease. So current challenges. Organizations such as WHO, or the World Health Organization, work to resolve complex and rapidly changing issues. So they use an agenda to do this. They promote development. They foster health security. They try to strengthen health systems. They're looking at evidence and research. They, again, partnerships, even an organization that's international in itself, right? And of course, improving performance. So things that we have to think about when we have a public health problem. And again, it's not far-fetched for what you think about with an individual. What's causing the problem? What's the burden of disease? What's the prevalence and the risk factor associated with it? What's the ability of it affecting the population as a whole? And again, you can think about it in relation to our job or other jobs. What's the seriousness of the problem? Because that's ultimately gonna impact action, right? What's the economic or social impact? We talked about that with diabetes and the cost of insulin right now. That is a huge impact on our society. What's the public health concern? Can we go out and work like normal? Is it COVID-19 and we gotta stay at home? What's the seriousness of it, right? The political will to address the issue. Availability of resources. I can remember when COVID-19 happened and when we finally got back to work, there became a shortage on N95s and had to use the same N95 all day of the week. That's not fun, and it's disgusting, right? But that was our reality at that point in time. Even if I wanted to personally buy it on my own, you couldn't touch them. So that's where you see availability of resources. There may be a requirement for group action, multiple people getting involved. So we talked about political, we may have to get somebody politically involved. Availability of current interventions, what's worked in the past that maybe we can utilize while we're trying to come up with a better solution. Cultural appropriateness, that's huge. And of course, health equity. This is really important to know. So dental public health focuses on oral health care and the education of the population, with emphasis on the utilization of dental hygiene services. So it may surprise you to know that the World Health Organization actually has current dental public health efforts. So this is just links that if you wanted to look at things that they're currently working on. Dental public health is also known as community public health. And I say that because you may see it differently on the board exam. That way you know they're interchangeable words, okay? So dental public health, again, is the delivery of dental services, shocker, for a population, and that involves a variety of institutions, infrastructures, and activities. So that's gonna be both national and local. And they need to be implemented across all areas to ensure the same coverage, quality, and performance of services. That's why you see this huge movement of teledentistry, right? Because there are people out there who live in rural areas and they don't have a physician's office where they live. They don't have a dental office that they can go to. And even if they could, it's not feasible for them financially to get in their car. Maybe they don't have a car. Maybe the bus metro system doesn't go out to where they live. Maybe they don't have a family member who cares to go pick them up and take them places. You see what I'm saying? I mean, you just domino off one another. So again, dental hygiene was initiated originally as a public health profession, and it focuses on the population versus the individual. So this just kind of shows you guys how the roles are a little bit different for a dental hygienist that's in private practice versus a dental hygienist who's working in a public health setting. So you can see, like, our diagnosis is different. We're doing a community dental diagnosis based on all the research we've come across versus straight up looking in an individual's mouth and coming up with what we need to do, right? There's a lot more different documentation associated with the public health hygienist. I have a really good friend who graduated with me, and she works in a public health clinic. She signed a 2-year contract, which she renewed because she enjoyed the job. And they paid off all of her dental hygiene bills. So, she said that it's hard work. She's probably overbooked a lot, but it's very rewarding. And so, she has really good benefits associated with her job that maybe in a traditional office she wouldn't be offered. Plus, she gets loans paid off. So it's pretty nice. Something to think about. She normally comes to our class via Zoom in community too. She'll tell you about her experience, how she got started with it, who she contacted, that kind of thing. I do know there is a clinic in Northwest Arkansas. One of our former students, Anel, she works there. Okay, so the Arkansas Department of Health. This is essentially what you would deal with on a state level. And I'm sure you've been shown this, but in case you haven't,